Hi, Jenny, do you want to get started?
Okay. This session will be recorded. So, good afternoon, everyone. Thank you guys for joining us today for Barnett's Youth Vaccine Focused Information Session. My name is Fedek Shati. I'm 17 years old and I'm a final year in Whitefield School. As you all may know, the government recently announced that COVID-19 vaccine will be available soon for 12 to 15-year-olds, and this session will be an opportunity for young people to express any questions or concerns they may have around the vaccine, and these will be answered by leading healthcare professionals in Barnet. We are joined by Year 9 pupils from my school, and our panel of healthcare experts will be taking questions from the pupils shortly. To start today's session, I thought I would share my personal views on the vaccine from an older teen perspective. I personally have not had my vaccine yet, and like many other young people, I have been quite hesitant to take the vaccine as well. And this was because I've heard about some of the side effects and a few things that I've heard going around. But after I did do my research and did go into like what it is and how it will benefit us and the people around us, I decided that I will be wanting to take it. And I've seen how it would affect people around me and, like, for example, family and friends, and how they were affected with COVID as well. And they did suffer quite badly. So this has all helped me inform my final decision. I have decided that I'll be taking the vaccine through maybe a walk-in clinic, or I might book it, as I believe that the best possible choice I can make for my health in this global pandemic. And I also feel that I'll be doing my part to help protect the health and community, and the well-being of my community as well. While I cannot tell any other young person what to do with their body, I would strongly advise other teens to get the vaccine as well. Not all of you will feel safer. It was Not everybody will feel safer, but you'll also feel a sense of fulfillment knowing that you've done your part as a greater cause, which is to help save lives. I'll now hand over to Barnett's healthcare team.
Oh, sorry, I missed that. I'm supposed to introduce myself. Good afternoon, everybody. My name is Janet. I'm a public health consultant at Barnet Council, and I've been working on managing COVID infection, COVID outbreaks for the last year and a half. Why do we want young people to get the vaccine, or why would we like 12 to 15 years old having their vaccine? It is very simple. We would like to protect all Barnet residents. And whilst it is true that more older people or people with underlying health conditions, they are at higher risk to get COVID, young people can still get infected, and even if in small numbers, they can still get even severely ill or end up in hospitals, although it is more rare than in older people. But the vaccine is important also for other reasons. It is contributing to protecting others as well. The more people get their vaccine, the more protected are those people who are more vulnerable or cannot have the vaccine on their own, especially older people or those who are very vulnerable. And what is very important for young people, it will cause less disruption to education if as many young people as possible do get their vaccine. And it is important more than ever because we see that the infection rates all over the country, but also in Barnet, they are still quite high. Even if in general the numbers don't change that much, we do see that more and more cases are related to children, young people, especially those in school age. Over 1/3 of all cases are among school-age children. And the sooner we get as many people vaccinated as possible, the sooner we can return to really more normal life, and we can do all the things we like to do with less worries and less concerns. I don't want to bore you out with more details. You can ask any questions you might have later, but I will hand over now to a colleague of mine, Bavita, and then Dr. Nick, who will tell you more about what we do in Barnet.
Thanks, Janet. Afternoon, everyone. My name is Bavita. I'm a public health strategist in Barnet Council, and I work with Janet. So I'm just going to talk to you a little bit about the risk and how you can get the vaccine. So one of the most common questions we get with the vaccine is it safe? So the medicines regulator, which is the MHRA, has confirmed that the Pfizer vaccine is safe and effective for 12 to 17-year-olds. And this is following rigorous review of safety, quality, and effectiveness of the vaccine in this age group. And we've also benefited from having data from the US, Canada, and Israel, which have already offered the vaccine universally to young people aged 12 to 15, with no safety concerns being raised. Like all medicines, vaccines can cause some side effects. Most of these can be mild and short-term, and not everyone gets them. So the most common side effects are having a heavy or sore arm, feeling achy or tired, or having a headache. And most tend to be short-lived or only last a day or two. Now, in very rare situations, some cases of inflammation in and around the heart have been reported in young people. Now, these cases are mostly seen in younger males and mainly occurs within a few days of the second dose. The condition known as myocarditis is extremely rare after the first dose of the vaccine. So if you experience chest pain, shortness of breath, or palpitations after the vaccinations, you're advised to seek medical advice urgently. But even with this really rare side effect, you will feel better with following rest and simple treatment. So we've now covered a little bit on the risks and how you can and the benefits of the vaccine. So how will you get the vaccine? So 12 to 15-year-olds will be offered the vaccine through a school-based vaccination program. So it's the same team that offers your HPV and the 3-in-1 boosters in schools. Schools and parents will be notified when the vaccinations will be taking place, and you'll be given a consent form that your parent and guardian should sign, giving you permission to have the vaccination. So at your vaccination appointment, you'll be offered 1 dose of the Pfizer vaccine. 2 doses are recommended for those who have any health conditions or are household contact with someone living with a compromised immune system. So it will be given as injection into your upper arm, and you'll be monitored for 15 minutes after your vaccination, and then you're good to go. So that covers our short introduction on benefits and risks into the vaccination. So I'll pass on to Fedek to cover any questions that you may have.
Any questions?
Oh, we didn't realize that.
Yeah, that's a good idea. If the feedback is too strong, we'll just keep an eye on the chat box and we'll answer the questions. Or perhaps if you have a headset at hand or headphones, you can connect if anyone would like to speak up directly.
So I'll come in here. Hi everyone, I'm Nick Datani, I'm a GP. I'm in the Borough of Barnet. Nice to see you all. So the question here has been asked about whether there's any more side effects from those who've had an operation. So I suppose it depends how long ago the operation was and what operation it was. We wouldn't recommend having a vaccine soon after any operations. As long as it's been a week or two and you're feeling better, then usually you're going to be absolutely fine to have the vaccine, and the side effects will remain exactly the same as anybody else. And just remember going through what they're likely to be for you. And most people, they're really, really mild side effects, okay? So the commonest things that you're going to get is a bit of a painful or heavy feeling or tenderness in the arm where you had the injection. You might feel tired for the first 1 or 2 days. Some people might get a bit of a headache or a body ache for the first 24 or 48 hours. And particularly young people of your age group might also have sort of mild flu-like symptoms for 1 or 2 days. And that quickly settles down and you should be feeling back to normal. All right?
Sorry, I didn't get that. It came through late. Any other questions?
Nick, do you have an answer for the next question as well? It is, why is the vaccine through injection and not through nasal spray?
That's a really good question. So that's come from Hassan, hasn't it, there? So it's actually been discussed, actually. So vaccines that are sprayed into the nose could actually really help stop spread coronavirus if it can be proven to work. So the answer is it hasn't been proven to work just yet, and there isn't enough data at this stage really to know whether a vaccine can be delivered through the nose. And I know that in the USA, as many places in the world, they're actually trialing COVID vaccine through an intranasal route at the moment, but it hasn't come through yet. So, you know, what I would say is watch this space. It could come in the future, a bit like the flu jab is now given in young people through the nose. It probably will come at some point, but it's not here yet. So there's no reason why it can't be. It's just not been developed at the moment. And because they've had to mass produce vaccines, the easiest thing to do was to mass produce it in one way, and that was through an injection. But I'm pretty sure in the future, you know, that we may even have combined vaccines where you end up having your flu and your flu and COVID vaccine in one go, and it might be through an intranasal route. So I suspect, Hassan, the answer is it will come. It's just not here just yet.
Yeah, so I suppose we just need to be patient and take one more jab into our upper arms this season. And I would happily take a nasal spray if we need some in future as well. So as Nick said, let's just watch the space. Okay, there is another question I see. Hannah is asking, at what point will teenagers need a second dose?
Shall I take that question?
Yes.
So the UK has made a decision around the current evidence and acknowledging the potential but the very low risk of myocarditis that I explained before. So a single dose is effective within this age group, but the advice may change to promote to second dose following further evidence. So currently the JCVI are advising for 1 dose, but that may change in future.
I think just to add to that, and I think it's based on risk, isn't it? So the risk is very, very tiny after 1 dose, and just very, very slightly higher after the second dose. So I think sort of in the first dose, it's I think it's sort of 12 cases in every million, and the second it sort of doubles up a little bit, so it's incredibly rare. But I think until we have further information from the Chief Medical Officer, that decision won't be made. But I suspect in the coming few months we'll know more about whether younger people will be having the second dose or not.
Thank you, Nick. And we have another question from Victoria. She's asking whether vaccinated teenagers will get a certificate to prove they have had it. Nick, please correct me if I'm wrong, but I suppose the certificate, the proof itself, works exactly the same way as for adults. It can be accessed via the NHS app on mobile phones, for example. They could be requested to be sent by email or post, so you can have it or paper. But whether or not you need to prove you have the vaccine, that's still being discussed as for adults as well. You probably have heard about COVID passes, vaccine passes. Some other nations or countries have them, but in England at the moment, it still hasn't been decided that people would need to prove their vaccination status. But that's just another thing that might change in a near or further future. But at the moment, you will have the proof of your vaccine, but right now you are not required to show it to anyone.
And then just to add to that, so if you're under the age of 13, your parent or guardian would have the NHS app under your name, and when you hit 13, you can opt to do one of two things until you're 16, and that is give consent to your parent or guardian to continue having the NHS app under their name, or you can have your own NHS app on your own phone at this age group, 13 plus, and decide to see your own COVID passport. If someone doesn't have a smartphone or access to the NHS app, as Janet said, you can call 119 and they can post out a printed copy of the COVID passport, which contains proof of your vaccine. Or finally, you can speak to your GP practice, who can print a copy if you've had it done through there.
Thank you. And I see the questions keep coming. And Nick, I suppose you will be the best to answer the question whether it matters if the jab goes into a particular arm. And that's from Abdullah.
So Abdullah, yeah, it's a good question. So it's generally, in most people, it's absolutely fine to go either into your left or your right arm. It goes quite high up, just around there. It's absolutely fine. Now, there will be some circumstances where you can't have it in one arm, but that's not based on the vaccine, it's based on you. So, for example, if you've had an injury to one of your arms and it's really sore already, you might not want to have it on that arm, for example. Or if you've had any surgery around that side of your body, for example, if you're a woman or a man who's had a problem with your breast tissue, then you might not be able to have a vaccine in that particular arm. But for most people, you can have it on either side.
And there is another question I see, whether people younger than 12 will eventually get the jab. And here the answer is once again, we don't know at the moment. Research is going on as we speak at a very high speed, and things that are not advised today might change in future. So at the moment it is for 12-year plus, and Nick, you might be able to confirm there might be younger children eligible under specific circumstances, and maybe you can tell more about this group.
So currently there's only eligible in 12 plus. So even if you've got a health condition or you've got a problem with your immune system, there is a trial in New York and in Germany at the moment between the ages of 5 and 11, and that's giving the half-strength Pfizer vaccine. So it's half the dose of the current Pfizer vaccine, and that trial is going on at the moment, and it's about 2/3 of the way through. So that will probably be completed probably early next year, and then it will go towards whether it will be approved or not. So I suspect it will be sort of early next year whether there'll be a decision about the licensing of Pfizer vaccine in ages 5 to 11. And if that does come about, it will be for half of the dose than it currently is.
I'm just looking at the chat. Sky J is asking, what is the percentage of people suffering harmful side effects? Is that, sorry, Nick, we are putting you on the spot here, but you might have the most real information from your practice?
Sure, no problem. So again, as I said earlier, the commonest ones are really sore arm, headache, joint pains, sort of fever and chills, and feeling a bit tired. And they're actually really, really common. It's actually very, very rare to have anything more than that. So in particular, with the Pfizer vaccine, which is what we're giving in the younger population, the risk of blood clots, for example, hasn't been seen like it has been in the rare cases with the AstraZeneca vaccine. So there's actually a really, really low risk profile. Now, what we're actually seeing is that sometimes with the second dose, people are having more of those side effects than the first one. So there's a bit more of an immune response with the second Pfizer vaccine. Some people get more of a flu-like illness or more of a headache after they've had their second jab. But actually, we're not really seeing anything more than that. So those mild symptoms are sort of in about 10% of patients. So 10% of you are likely to get sort of that fever, pain, swelling. Things that are really unusual, so things like problems with itching around the site or an allergic reaction or feeling really unwell, affects about 1%, so 1 in 100 of you. And then those really rare side effects are about 1 in 1,000 to 1 in a million, depending on what they are. And often they're more sort of the allergic reactions that people have had, sort of a widespread rash, for example, that they've needed to take antihistamines for, or something more than that, or they've had 1 in a million chance of swelling around the face. So really rare, and I haven't personally seen any. And I've been involved in a vaccine program which has vaccinated about 40,000 people so far, and we haven't had any of those serious or rare side effects yet in any of those patients. So again, we are seeing the sort of normal sore arm, headache, flu-like in about 10-15% for a couple of days. Even I had that, but I mean, what I would say is that I'd rather have a sore arm for 24 hours than get COVID.
Thank you, Nick.
Okay, a question for me, if I had side effects. I haven't had my vaccine yet, but I'm due to have my vaccine. But I do know of a few friends, family that have had the vaccine done, and they've just had a sore arm maybe. Other than that, they haven't really let me know of any other side effects they had. It was very mild side effects.
Thank you, Fedek. And I don't know if it counts because I'm over twice of your age, but I've got a quite sore arm for a day, but after that passed, I didn't even remember the vaccine anymore. And most of people I know, they had a sore arm, but very few of them had, like Nick described earlier, some flu-like mild symptoms. And the next question, can young people with Down syndrome, if they can have the vaccine? And that's a question from Precious.
So actually what we can say, Precious, is actually patients with Down syndrome are at higher risk of infections and becoming more unwell. So they might have a weakened immune system. So they're the patients that we want to put at the top of the priority list. And hopefully, if they're certainly over the age of 12, they've already been vaccinated, I would really hope. And if they haven't, I'd urge family and friends to bring them forward because they're really at risk of getting seriously unwell with coronavirus. And they're the patients that we want to put at the front of our queues and protecting from this because they really are at risk. So they can absolutely have it, and we encourage anyone with a medical condition like that to come forward.
Is there any question we might have missed in the chat box? I think we answered all the questions that are in. Yes, we have.
I think there's one question from Sophia. If we're still undecided and decided to do it later, where can we get it done? So I know that there will be mop-up clinics offered by the primary school team, but Nick, do you know whether it's going to be offered in primary care?
So we're waiting to hear about that at the moment. So there is discussion about whether at the end of October GP practice will be able to offer it, but we don't know just yet. So I'm sure we'll find out in the next couple of weeks. So if you haven't decided, I'm pretty confident to say that there's always going to be opportunities for you to go, if not to a mop-up site, like Bhavita said, or back to your GP. And there'll be absolutely clear modes of communication. I'm sure there'll be posters, leaflets, websites, Instagram, Facebook, everywhere. There'll be promotions on how you can get vaccinated if you haven't done so, because we're really pro in making sure there's equal opportunity for all of us to get vaccinated whenever we decide and feel ready to come forward.
Yes, just to really reassure you that we'll make sure that everyone who wants to get the vaccine will get one, even if it's later. It is important to get it, so whether it's today, tomorrow, the day after, at any point you are ready, we'll do our best to get it to you as soon as possible.
So we can see that some people haven't made it onto tomorrow's list. Well, I think the first thing to say is well done for making the decision that you want it, because we know it's been hard for some of you. So we're really confident that you'll all be able to get your vaccine. If it's not tomorrow, then certainly during the next week or two, I'm sure there'll be places where you can go and have it done.
There is a question from Loretta. Is it just Pfizer, or can you get Moderna?
Who wants to answer that?
I'm just looking at any of you, Bhavita or Nick, but I think it is Pfizer, isn't it? Only Pfizer.
That's correct. It's only Pfizer at the moment. It's the only one that's been given the current license, and it's what the NHS England and the government have currently ordered in the UK. And it's the one that's gone through the trials in the UK, America, and Israel. And so we're the three countries that have been involved in the third dose Pfizer vaccine, which has been approved, and also the Pfizer vaccines in 12 to 15-year-olds.
Great. All questions finished. If I can just add here, if there are any questions at any point later you might have, you can either ask your head teachers. They would have contact details from Barnet Council, from other health professionals to ask, or I don't know, Bhavita, maybe if we put our general inbox here if anyone would like to ask a question individually. We can make sure it gets answered by a public health or health professional. And maybe if Marianne could confirm that on social media, wherever you see posts from Barnet Council or from local NHSC teams, if you have any comments, if you put questions there, I think they would be answered there as well.
Yes, they will be answered there too, absolutely. So however you want to get your questions across, we are more than happy to answer them. Fedek, do you want to say a few words to close the session?
Fedek, you're on mute.
Can you hear me now? Okay. This was a great session, and thanks to everyone for attending, Whitefield for your fantastic questions, and Barnet's public health team for your thorough answers. To keep up with the latest information on COVID-19, the vaccine and youth-related content, please follow @BarnetYouth_ on your Instagram app. We will be posting sessions and little clips from today's session in case you wanted to listen back to some of the answers.
Thank you, Fedek, for facilitating this today. It's been really, really nice to be with all of you, even from afar. I hope there will be opportunities soon to meet you in person. That would be nice.
Take care, everyone. All the best.
Great, thank you.
Bye.